Hi guys, John Adamson, the Rehab and Documentation Guru. I'm just doing a little video on an analysis of a patient I have on maintenance therapy. So I'll give you a little bit of background on this patient. She has a progressive neurological disorder, and as a result, she's also developed some problems with orthopedic issues. One is I believe she has hip dysplasia. I can't confirm that. There's no x-ray that she can get right now. She's stuck at home, especially because of COVID, but also because of lack of availability of caregivers to bring her out. And she's got contractures going on. So she's got orthopedic things that have arisen from her progressive neurological disease. And when you're seeing maintenance patients, one of the things you've got to do is you've got to justify why you need to be seeing them. Is it possible that somebody else could be maintaining this patient at this time? And that's questionable. There's some things going on related to her hips and her range of motion that make it concerning that a non-licensed person would work with her. Because there's things that I've got to do while I'm stretching her to get her range of motion to maintain, which also in turn impacts her mobility, that a non-licensed person without training in anatomy and kinesiology wouldn't think about. So I thought I would just share with you the analysis I wrote from today's visit, justifying further care. It's been a little bit since I've done this on this particular patient, and I figured it's about time that I did. So here's what I wrote on the analysis. PT is medically necessary due to, and then I give a bullet list of the issues. Number one, contractures. But contractures by themselves wouldn't be enough. Number two, lack of appropriate positioning devices. And when devices arrive, need for training in its use. So she's awaiting not only splints for her ankle contractures, but also a seating system. And that should be on its way very soon, the seating system, and she should get her orthotics this week. So I'm going to need to do some training related to that. She's not going out, she's stuck at home. Those are going to be delivered to her house, and she's never used them before. Number three, inability to safely and effectively perform range of motion to extent of limitations and without significant increase in pain attempting them herself. So she is very weak from this progressive neurological disorder. She's not able to do the range of motion very well herself. She's not getting caregiver support. Now, if she did have caregiver support, is it possible that I could teach that caregiver to do the range of motion? And that would be, if I could definitely train them to do it safely and effectively, she doesn't need maintenance therapy. But there are concerns related to how the range of motion is done, which I've elaborated a little bit upon in this note. But there are some concerns about her being able to do it safely, because safety with hip dysplasia, which I suspect she has, is an issue, but also pain. She puts herself in a lot more pain when she tries to stretch herself, because I can do some manual techniques, which I do document on her, that help eliminate or at least reduce the pain while I'm stretching her. Clinical presentation. This is number 4. Clinical presentation is variable in relationship to tone, pain, and tolerance to stretching. So that variability of clinical presentation means that she's not quite stable. And that means that any non-licensed person working with her on a day-to-day basis probably wouldn't adjust how they approach, because they wouldn't know better. I do, though. I can make fine-tune and adjustments to how I handle the stretching, the mobilization, that can be variable from day to day with this particular patient. So I'm just pointing this out, that this is a variability that a non-licensed person wouldn't be able to handle. And then I just go on to say the negative. So in this analysis statement, I'm saying, here's the things that I'm necessary for, but now I'm going to tell them what would happen without me. Without skilled PT, patient is at risk for further contracture development, and she really is. She's developed a lot already. Increasing pain, which she's gotten. Development of pressure ulcers due to contractures and lack of procurement of positioning devices. So she's got contractures that are developing, and the tighter she gets in certain positions, the more likely she's going to get problems with the bony prominences that are weight bearing. And then I say, and further reduction in mobility because of acquired deformity. So I'm basically pointing out the things that could happen as a result of not getting therapy. I always compare this to the glass half empty, glass half full perspective. I give them the glass half empty, pessimist, without therapy, you can expect these things to happen. They're bad. And then I give them the glass half full, the optimist perspective. With therapy, you can expect these things to happen, these positive things. Anyway, John Adamson, the Rehab and Documentation Guru, just giving you a little bit of a synopsis of an analysis statement for a maintenance patient. Think about what makes it absolutely necessary that you're in on the patient for your maintenance patient every single day, every single visit. And the big one out of that list of stuff I did was the variability we see in some patients. Anyway, take care, God bless, and have a great day.